Let's talk about something that most men tend to ignore until it begins to interfere with everyday life: prostate health. In today's video, I'm going to walk you through a comprehensive, scientifically backed, and completely natural approach to supporting your prostate without having to rely on medications or undergo surgery. Now, while this topic is clearly male-focused, it's important to note that women should tune in as well. Why? Because in clinical settings, it's incredibly common to see men brought in not because they're concerned themselves, but because their partners have noticed something isn't right. This tendency for men to overlook their health is one reason why issues like benign prostatic hyperplasia, or BPH, go unaddressed until symptoms are severe. So let's be proactive rather than reactive. The prostate is a small gland in the male reproductive system, situated just below the bladder. It surrounds the urethra, the tube urine travels through. As men age, this gland tends to grow larger in response to hormonal changes. And because of its location, an enlarged prostate can press against the urethra and the base of the bladder, leading to significant urinary issues. This isn't just hypothetical. Statistically speaking, it's extremely common. By age 60, 50% of men will have some degree of prostate enlargement, and that number jumps to 90% by age 85. Now, let's explore why this happens, and more importantly, what we can do about it. Aging naturally shifts hormone levels in men. Testosterone begins to decline, while the relative proportion of estrogen often rises. This imbalance is significant when it comes to prostate growth. The gland converts testosterone into dihydrotestosterone, DHT, a more potent form of testosterone. DHT stimulates the growth of prostate cells and, when left unchecked, contributes to its enlargement. At the same time, higher relative estrogen levels also stimulate tissue growth within the prostate. Another key factor: men with higher fat mass, especially abdominal fat, produce more aromatase, an enzyme that converts testosterone to estrogen. This hormonal conversion accelerates the process of prostate enlargement, and we'll discuss how we can address this naturally. Several lifestyle and genetic factors elevate your risk of developing BPH. First, insulin resistance and type 2 diabetes. Elevated insulin not only wreaks havoc on your metabolic health, but also increases inflammation, which accelerates hormonal imbalances and contributes to prostate cell proliferation. Therefore, a low-carb, whole foods-based, anti-inflammatory diet is one of your most powerful tools to mitigate this risk. Second is obesity. Increased fat mass doesn't just affect your cardiovascular health, it directly correlates with decreased testosterone and increased estrogen, both of which drive prostate growth. Weight management is not optional, it's essential. Lastly, family history plays a role. If your father or your grandfather struggled with enlarged prostate symptoms, be vigilant. That genetic predisposition means early intervention is even more important for you. So how do you know if your prostate is enlarged? There are some hallmark signs. These include a frequent need to urinate, particularly at night, nocturia, difficulty fully emptying the bladder, urinary incontinence, and a weak or interrupted urinary stream. Some men also experience painful urination or a sudden, urgent need to go. If any of these sound familiar, do not ignore them. While they may start subtly, they can progress quickly if underlying causes aren't addressed. Let's begin with diet, because it's your foundation. Avoid estrogenic foods and exposures. Soy-based products, plastics that leach xenoestrogens, and pesticide-laden produce all disturb your hormonal balance. Prioritize organic, unprocessed foods wherever possible. And toss the plastic containers. Opt for glass or stainless steel instead, especially when heating food. On the other hand, increase your intake of foods rich in lycopene, a powerful antioxidant that has been repeatedly shown to support prostate health. Lycopene is abundant in tomatoes, watermelon, papaya, pink grapefruit, carrots, red bell peppers, apricots, and red cabbage. The more vibrant the color, the better. Lycopene helps mitigate inflammation and oxidative stress in the prostate gland. Next, let's talk supplementation. But let me be clear, supplements do not replace a poor diet or sedentary lifestyle. They work best as a complement to healthy habits, not a shortcut. Start with green tea extract, which is rich in polyphenols, specifically EGCG. These compounds have potent anti-inflammatory properties and can reduce mechanical pressure on the urethra, thereby improving urinary flow. You're welcome to drink green tea daily, but therapeutic doses often require supplementation. Another critical micronutrient is zinc. As men age, not only do their zinc stores decline, but estrogen can impair zinc absorption from the gut. Zinc plays several crucial roles, not just in immunity and testosterone production, but also in inhibiting DHT formation, which, as we discussed, drives prostate enlargement. Now let's highlight a heavy hitter: saw palmetto. Saw palmetto has been researched extensively and shown in multiple randomized placebo-controlled trials to significantly reduce symptoms associated with BPH. It works by inhibiting 5-alpha reductase, the enzyme that converts testosterone to DHT. It also appears to block DHT from binding to androgen receptors within the prostate, reducing tissue growth. Additionally, saw palmetto has been shown to support a healthy fluid balance within the gland, which can improve comfort and reduce urgency symptoms. Surprisingly, cranberry fruit extract also shows promise. While typically associated with urinary tract infections, cranberry's active phytonutrients, specifically proanthocyanidins and flavonols, demonstrate anti-inflammatory and antioxidant properties within prostate tissue. Clinical studies show that 250 to 500 milligrams of full-spectrum cranberry powder, not just juice, taken daily, can provide measurable symptom relief in men over 45. Again, this benefit doesn't come from eating handfuls of cranberries, but from concentrated supplement-grade extracts. Next, consider the soothing relief of an Epsom salt bath. While it may seem unrelated at first glance, magnesium sulfate, the core component of Epsom salt, is well known for its anti-inflammatory effects. Regular use can reduce muscle and pelvic floor tension, improve sleep quality, and may even alleviate lower urinary tract discomfort associated with BPH. Soak in a warm bath with 1 cup of Epsom salts for 15 to 20 minutes. And feel the difference. Let's shift focus from what you put into your body to what you do with your body. The importance of regular movement cannot be overstated. Studies out of Harvard University found that walking for just 30 minutes per day was associated with a 25% reduced risk of developing BPH. Exercise also directly improves insulin sensitivity, reduces body fat, balances hormones, and lowers systemic inflammation. Whether it's walking, resistance training, swimming, or cycling, make movement a daily habit. The results accumulate. Let me emphasize something crucial. None of these protocols work overnight. Prostate health, like all aspects of wellness, is the result of consistency, not quick fixes. I often see patients try a supplement for a few days or a week and then give up when they don't see immediate relief. That's not how the body works. The prostate didn't become enlarged in a day, and it won't be healed in a week. You must commit to your routine, changing your nutrition, reducing your exposure to hormonal disruptors, adding targeted supplementation, and moving your body every day. When these strategies are layered together, that's when results start to appear. Week by week, month by month, your body will begin to shift back toward balance. So no, you do not need to rush to invasive interventions. You have options, powerful, evidence-based, and natural ones, right at your fingertips. And that, gentlemen, is how you take back control of your prostate health, naturally, intelligently, and sustainably. Thanks for watching. I hope it helps. If you like what you see here, don't forget to subscribe and share with your loved ones.